Hello, everybody, and good evening. And I'd like to thank you all for joining the latest Ask the Leaders Facebook Live Q&A. For those of you that don't know me, I'm Councillor Keith Aspden, the leader of City of York Council. And I think many of you will know the format of these sessions from previous events. But if you're tuning in for the first time, I'm going to ask the panel and our guests to introduce themselves, and then we're going to begin to answer any questions that you have. This week, I'm really delighted to be joined by a number of different representatives, including from the NHS Foundation Trust, as well as colleagues from across the council. And we look forward to discussing your questions, particularly on how to promote health and wellbeing, and on the latest public health advice and how we can best support each other through difficult times. Before I go on and ask the panellists to introduce themselves, I'd just like to touch on a number of key topics from the past week. We remain in national lockdown, as outlined by the Prime Minister on the 31st of October. And it is worth saying that thanks to the efforts of local residents and businesses here in York, the rate of infection in our city has significantly decreased, with York's 7-day rate of new COVID cases dropping now below the both regional and national averages. And nonetheless, we can't be complacent and undo that good work. And we know this has been a difficult year for everyone, but it is vital that we can continue to follow that public health advice and do what we can to stop the spread of the virus. And it is important to highlight that despite the restrictions, the city's parks, public toilets and household waste and recycling centres remain open, and many of our services will continue throughout November. The city's foot street restrictions will be reverting to finishing at 5 p.m. rather than 8 p.m, and the temporary loading bans will be removed. And this is to help ensure additional support for local businesses who will now be moving to delivery services. But as well as that, key NHS workers will be able to park for free at the Union Terrace Coach Park, and the York, Tanghall and Acomb libraries will remain open for people to go into to use the public computers and to collect items ordered online. Whilst we remain under lockdown restrictions, it is incredibly important that we look after ourselves, as we'll be discussing later, both physically and mentally. And should you need support or one of your neighbours, do contact the council. You can call the helpline 01904 551 550, or you can email covid19help@york.gov.uk. Now I'll stop speaking and ask our panel to introduce themselves. I'm going to go round in the order that people are on my Zoom screen, which I know might not be the same for everybody, but that will explain. So in no preference, Naomi.
Hi, thanks, Keith. My name is Naomi Lonergan, and I'm the Director of Operations for North Yorkshire and York for Tees and Wear Valley NHS Trust.
Thank you very much, and welcome to your first Facebook Live. Also, welcome to first Facebook Live to Kath.
Hi, my name's Kath Davies. I'm a consultant clinical psychologist, also working in the Tees and Valley Trust.
Thank you very much. And those that have been before to Facebook Lives, Carol.
Thank you, Keith. I'm Councillor Runciman. I'm Executive Member for Health and Adult Social Care, and I'm Chair of the City's Health and Wellbeing Board.
Thank you very much. Maxine.
Thanks, Keith. I'm Maxine Squire. I'm Assistant Director, Education and Skills.
Thanks, Maxine. And Sharon.
Hi, everyone. I'm Sharon Stoltz, Director of Public Health.
Thank you, Sharon. You probably feel a sense of deja vu with the number of Facebook Live sessions you have now done and come on. So thank you very much for that. So we have had a number of questions submitted in advance. So I'm going to be taking some of those pre-submitted questions first. But if you do have any extra questions or comments on what we're talking about, please get involved on Facebook and leave your comments. I'll try and get as many questions in as possible. But if we don't have time to answer, I know that our communications team will be responding on Facebook Live, and we'll keep answering your questions even after this Facebook Live session has ended. So do please ask questions, comment, and get involved. So we had a number of questions that I've grouped together. and I'm going to take two of them first. So we had a question from Charlotte, which was, more needs to be done for mental health this lockdown. Getting a doctor's appointment is impossible. And then Leanne also asked, lockdown is going to be hard. What mental health support is there? So for that one, I'm going to go to Naomi, please.
Hi, thank you. So I think what I would start by saying is that we really all understand that the impact of the COVID restrictions have been quite difficult for people, and it's been a really exceptionally challenging time. Some people for the first time in their lives might be experiencing feelings of depression or anxiety. And for those that already have mental health conditions, people may feel that that's worsening during this really restricted period of living that we've got. I think the important thing to know is that there is support available. And whilst primary care is one option, there are also many other options for people to seek support, advice and guidance. Looking after your mental health is really, really important at the moment. And there are some brilliant everyday resources out there that can support your emotional and mental well-being. One of those is the NHS's Every Mind Matters website, and that provides advice on well-being during COVID, such as coping with anxiety, money worries, coping with the change that we're all experiencing, and how to manage staying at home. Along with wider mental health tips, and they also provide a free mind plan so that you can maybe sit down with a pen and a bit of paper and maybe really think about what's going to work for you individually once you've had a look at those tips and guidance. In the Trust, we also provide a recovery college online, and there's a website available. I'm sure we'll be able to put that in the responses in this chat, but that offers a great range of emotional well-being resources, and there is some very specific COVID related course material within that could be helpful to people. For young people, there's a specific website as well that will support people up to the age of 25, and that's called TEWV, spelt with a K if you're looking for it online. And that provides free, safe and anonymous and confidential support for young people. And people can speak to counsellors as well on that resource. There's a lot of help and advice as well at livewellyork.co.uk, and that has all the information about local groups and sources of support in the York area. And there's a helpline that people can call as well if they want to speak to somebody in person. There's also practical resources such as the Oxford Mindfulness Centre and also the Time to Change programme as well that people can look up. And again, I'm sure we'll be able to provide contact details here. If people feel that their mental health or their levels of depression and anxiety need something a little bit more, we do provide a service that is improving access to psychological therapies known as IAPT. And people can self-refer onto that and access the website. And if they feel unable to do that, they can also ask their GPs to refer them to this service. And that can be helpful if you're suddenly finding it a lot harder to deal with life's daily demands. There's a low intensity course for people who are experiencing mild to moderate anxiety, specifically in relation to COVID-19, as well as providing a range of support for other types of mental health distress. If you've got a pre-existing condition and mental health problems at the moment, what we would suggest is, really stay in contact with your mental health care team, get in touch and let us know the additional support that you need. Our local services are still able to see you face to face if that's what you need. If you're anxious about that or you don't feel able to do that, we can offer digital ways of contacting you, a bit like we're doing now. And we have a digital platform called Attend Anywhere, so you can have a consultation online, and obviously we can do phone contacts as well with people if that helps. I think ultimately, if you feel that you're in a mental health crisis or facing some kind of mental health emergency, what we would suggest is contacting our free phone helpline that's available 24 hours a day, 7 days a week. There is a number that you can contact, and again, we can provide those numbers for people. And that's available for people of all ages so that we can direct people to the right form of support that they need, as well as for people who may have a learning disability and or autism. And there's advice and information about what to do in a crisis that's available on our Trust website, which is tewv.nhs.uk.
Thank you very much for that, Naomi. And I'm sure on Facebook Live, I'll make sure that our communications team puts those links and telephone numbers there as well, so they're available. Kath.
just try to unmute myself. Yeah, I think as Naomi said, this is a really challenging time for everybody. Everyone has been impacted by the pandemic, but everyone will have experienced it slightly differently. So I think, you know, what we don't want is for people to feel that they don't need to struggle alone, because there is help out there. And as Naomi said, some people do find going on apps or websites to get that information really helpful. Other people prefer to actually have a conversation with somebody. So again, you can, you know, our services are open, and we would really, really encourage people to attend. We can do that socially distanced, where as we need to, or we can do it, you know, digitally through these sorts of platforms. But I think, you know, it's fair to say that, you know, to feel some degree of difficulty managing these times is normal as well. I think everybody is experiencing, but we do know that there are some people who are going to be more vulnerable to that. So we particularly want to reach out and ensure that people know where to get that support and help if they need it.
Thank you very much for that. And what I'll say is, if any panelist ever wants to jump in, if you raise your virtual hands, although those on Facebook won't be able to see, I will, and then I'll be able to bring you in. So I'll move on to another pre-submitted question, which was asking us from Mike. I'm worried about the new lockdown because I was shielding last time. What help can I get? And I'll ask Sharon to start on this one, please.
Okay. Yes, thank you for that, and thank you for your question, Mike. What the lockdown period we're in at the moment, or the national restrictions we're in at the moment, are different from the national lockdown we had earlier in the year. And so whereas then people who were in the clinically vulnerable group were advised to avoid contact with people, that isn't the advice this time. We're encouraging people to go out and about, not to feel socially isolated at home, but to feel comfortable about going out, but just to make sure that you do that safely, really. So it's about restricting the amount of contacts you have with people that aren't close to you. In terms of the help that you can get, the council has continued with the support that was available to people from March and the start of the pandemic. There are the various support that can be provided through our helpline and through community hubs. So if you just are feeling lonely and isolated, we can connect you to people who can talk to you, contact you just for conversation. We can support with access to financial information about benefits that you might be entitled to, and also support with getting prescriptions and food, etc. So I would encourage anybody who is shielding, who feels that they need some support, to contact the council. And again, there's an email address and a telephone number that our communications team can put into the chat. So lots of help available that can be tailored to people's individual needs. It's not a one size fits all offer. It can be a tailored offer. So I would encourage anybody who is struggling or feels that they need help to get in touch with us.
Thank you very much for that, Sharon. A lot of questions we've had in advance and also in the local media about test and trace, both locally and nationally. And we had a question in advance, which was, is the test and trace system working better? in the city? And if I go to Carol on that one first, please.
Thank you. The short answer is yes. The long answer says that we're really grateful to all the people who have been alerted to have a test and have had one and then have self-isolated, because that has started to bring our infection rate down quite clearly. We had trouble at the beginning because the national system wasn't getting to everybody it should have got to. And really the improvement has come since we've had a dedicated test and trace coming down to us as a local authority. And whereas the national system was getting to perhaps 57%, perhaps, our system, which picks up those that the national system haven't reached, is getting to far more than that and up to about 90%. Some of the remaining numbers are people who are contacted but don't wish to be tested. And of course, it's not something you can force people to do. But most of them are people who are willing to have a test and to act on the information that that test reveals. So it's really good to know that the test and trace system in York is working better and that our residents in the city are responding to it and helping to bring the infection rate down. So thank you to everybody.
Thank you, Carol. I'll bring Sharon in a second, but I think there is a thank you to all of our partners. So whether it's the work on initially the drive-through testing site at Poppleton Bar or the walk-in testing site on the University of York campus, and then of course the creation of that local tracing service in particular to really supplement that's been going on. And we've all known that the capacity hasn't been there, which means the results have been back slow, which is then difficult for self-isolation to work. And how doing it locally and trusting local public health teams means that you can do more and you can do it quicker and you can reach more people. But equally, there's still a long way to go yet. And I think we're still obviously making the case nationally that, for example, to support everybody to self-isolate, there needs to be an incentive, for example, those that need to work or on benefits, or to students to make sure that system really works. And the other thing, before I go to Sharon, that there's been a lot of publicity about at the moment is mass testing, and what has actually been offered to local areas like York. So if I go to Sharon, having thrown that question in, that would be great.
So that was exactly why I wanted to come in, Keith. So great minds think alike. Yes, I wanted to put the story straight, really, in terms of some of the information that's been in the local press. That I've had lots of questions. I'm being contacted by a number of people today, wanting some clarification really around my position as Director of Public Health, but also the Council's position on mass testing. So just to put the facts really, York has not refused to participate in mass testing. We have been lobbying the government for local access to improved testing for some time. What we have decided, though, was to not put ourselves forward to be in the first wave of areas to do the new lateral flow testing. And that is really because these tests are new. They are only now being in the process of being rolled out. As a council, we needed clarification of the funding that was going to be available to us to be able to roll these tests out to our residents. And also, we needed to be very confident that we had all of the information that we needed in order to plan a really effective mass testing programme, to make sure that we could do that well, that we could do it successfully, and in a safe way for residents. I will stress that safe way, because this is new, and the government are rolling it out so quickly that we needed to find out more information before I was happy, really, and the council was happy to put ourselves forward. But we're doing that work now. There's more information that's now available. I will be taking some proposals to the Outbreak Management Advisory Board next Wednesday, and those proposals will include how we think we're going to be able to roll out the new lateral flow tests to up to 20,000 residents a week. So that's a lot of people to be invited for tests. And it's important that we take a little bit of time to get that system in place and working before we offer those tests to people. But I just want to reassure anyone watching that that is the position. We will be doing it in York. We believe it's important to be able to offer this service to residents, but the priority is to be able to do it safely, and we'll be able to share more information with you as that becomes available.
Thank you, Sharon. Did you want to come back in on that, Carol?
Yes. Can we just pick up the question that's just come in about putting it in Parliament Street?
You're taking over my role there of what supplementaries we are.
Oh dear.
So just for those watching, to clarify, we've had a question that's come in on Facebook from Saf, who asked why was the walk-in testing centre not somewhere like Parliament Street?
The Deloitte, who run the testing stations, have very strict and very careful regulations about where it goes and how accessible it is. There's got to be room for the setup, which is quite extensive if you've ever looked at one, and room for people to get there by, say, bikes, so there have to be bike stands. I can only say that I would think that Parliament Street would be much too small and not very accessible if the army was doing it to bring in vehicles and so on. So I think I can see why the inquirer asks about Parliament Street, but I don't think that'd be very practicable. And also I know that Deloitte's would say, no way, we need more room than that. So good idea, but unfortunately we can't do it.
I'll go back to Sharon on this one, because one of the things I know that obviously the walk-in testing sites were considering was where are residents living, or for example, where are students that are more likely to need the walk-in testing site, given that we had the drive-in testing site in Poppleton Bar. But I know there have also been, Sharon, discussions about a second walk-in testing site to make sure that more residents in different parts of the city had access. I don't know whether there's any update there.
Yeah, so you're absolutely right. Our aim as a council has been to try and work with Deloitte, who's the commercial partner who holds the contract with the government for local testing sites. And the aim was always that we would try and have a number of those local sites across the city to make it easier for people to access. The government's position has now changed on that. And so our bid that we put in for another walk-in testing site on the west side of the city was actually turned down. And the reason it was turned down is because the government, as we were just discussing a few minutes ago, are now offering local authorities the opportunity to do mass testing through the local flow, the lateral flow devices. And so that takes us down a different route. So I mentioned earlier there'll be discussions at the Outbreak Management Advisory Board next Wednesday. That's a live meeting, so anyone watching now can tune into that and watch that discussion, or send questions in beforehand. If there are questions about that, we'll be very pleased to receive those. And what we'll be now looking at is how we can have an integrated COVID testing solution that will work for us as a city and will work for residents as well. So that will mean an integrated approach, looking at the testing facilities that are already available at Poppleton Bar and the walk-in centre, as we've been discussing. The tests that GP practices are now going to be able to do in a very targeted way, and what we're going to be able to offer as a council with our partners with the new rapid tests. It's no good looking at all of that in isolation. If we're going to make it work for us as a city, it's really important that we plan that in a way that is going to be value for money, that is going to be really effective, is going to meet residents' needs, and ultimately support us in our goal to keep infections low, and then try and go back to as close to normal as we can once this lockdown is finished. So a little bit of a change in direction than what we were originally planning, but I think once we've managed to get all of the work done and the planning and all the logistics and everything sorted out, what we'll be able to offer residents is a better solution than the walk-in centre that we were originally planning. So kind of watch this space, really.
Thank you very much. A slight sort of different topic, but Saf also asked on Facebook, when do applications open for business grants? And what I can say is that the council took an emergency decision last week so that we were in a position to give those business grants out as quickly as possible and as soon as the government guidance is received. So we're now in a position to be able to do that. And there will also be a public meeting in the coming weeks with the executive member for finance at a decision session to decide on the discretionary business grants, which was a small amount of the total funding available. If any businesses want any more updates, if you keep up to date with york.gov.uk, and as soon as that government guidance has been released, we'll put the information and also links to the application forms up there. Or if you have any particular questions or want to find out more about an individual business, you can email economicgrowth@york.gov.uk, and our team or Make It York will help you as much as possible. And then a general point on business grants, that the latest business grant funding is really welcome. But it is not going to be able to help all businesses of all sizes, and it isn't going to be enough for what we need. So we're also continuing with our Back York lobbying campaign to make sure that we're talking with civil servants, with the government, to make sure that we highlight when any businesses are falling through the gaps or don't quite meet the criteria for government guidance. So get in touch if that is you and it does affect you, and we'll keep making sure that we pass that information back up nationally to hopefully make sure that they keep providing that support moving forward. So I'll then go back to some of our pre-submitted questions that we received and take us back to that conversation about well-being. And we had a question that was sent in advance from Louise, which is, I'm a great believer in well-being and mental health. And do you know if the government or local councils might look at more mental health first aid training for either staff or volunteers to help local communities? So I might bring in various people for comments from different organisations on this, but I'll start with Kath, please.
Thanks, Keith. Yeah, absolutely agree, kind of increasing the awareness around mental health and actually what support we can give to each other around mental health is really crucial. I know that the council do run the mental health first aid training, and as part of some national mental health changes to the way services are going to be delivered over the next sort of 6 to 9 months, we will also be looking to extend, so there'll be additional first aid mental health training. But I also know that the council do provide some really good services. There's a new wellbeing campaign being launched this week that's called Feel Real York. And that's really to encourage people to talk together about how they're feeling, and to signpost people where in their local community they might be able to get more help to do that. There's also Live Well York, and a new resource, Time to Change. It's called the Ask Twice campaign. Although that it is specifically aimed at men to encourage them to open up and talk to their mates and see how people are doing. I think one of the things that people do find difficult, whilst they might be worried about a friend or a colleague or a family member, sometimes it's really hard to know how to start that conversation in a way that will feel helpful. So there's some really good advice on the Ask Twice campaign, just to give people some pointers or some advice about how to start those conversations with each other. I think also there's just the general advice around trying to keep well, both physically and emotionally. And, you know, I know they are old adages, but it really is about making sure that you're eating well, that you do take some exercise, that you sleep well. And and that you can contact with others is really important, but it is absolutely vital that you do that in a socially distanced way within the government guidelines or through digital media like this. And there's also, you know, for families, there's lots of advice and support out there for young people. I think we're particularly mindful around young adults mental health at the minute. So Mind also has a Student Mind website that also provides tech support and can direct people to other more local support if they need it.
Thank you very much for that. And I think I'll bring Maxine in on that too.
Thank you, Keith. Young people have been mentioned, and obviously there is support for young people in schools via the School Wellbeing Worker Service, which is still out there supporting schools. There is also as well the School Nursing Service, which has a key role in supporting mental health inquiries in schools as well, and wellbeing, as does our Educational Psychology Service, and they produced a lot of materials for schools around wellbeing over the summer months, and they've also posted those online on the council website, so parents can actually access them. And they do continue to run a helpline which people can phone into, a weekly helpline. We've also commissioned York Mind to deliver on our behalf the Wellbeing for Education Return training materials, which are for training schools in wellbeing and mental health techniques. And that's being rolled out over the next few months. So it's starting in a targeted way with some schools that have been identified by York Mind to work with first on that package of training and support. And it emphasises wellbeing both for school staff as well as the way in which they can promote wellbeing for children and young people. So that's going to be quite an important resource over the coming months.
Thank you very much to both of you for that. We're going to move on now to a number of questions that were pre-submitted about schools. And the first one came in from Mark, which is, how is it safe for my child to go back to school when the country is in a national lockdown? But we can also see on Facebook that we've had a number of similar questions. So Tamara has asked, it feels like parents who both have to shield, but their children also have to go to school, are being put at an unacceptably high risk. So I'm going to ask Sharon to start us off on this, and then we've had a number of specific school and education questions that we'll go through with Maxine as well. Sharon.
Okay, thank you, and thank you for the questions that have come in. So in York, and Maxine will want to come in, I'm sure, and talk about this as well. We don't have any evidence of widespread transmission of coronavirus in our schools. We have obviously had cases of COVID in schools, but we haven't had any large outbreaks. We haven't had to close any of our schools. And all of the research evidence suggests that children are not particularly super spreaders of this virus in the same way that they are for flu, for example. That changes as children get older, and older young teenagers and older teenagers we know can spread the virus a little more, but primary school age children, there's hardly any evidence of spread of the virus at all. Children's education is so important. Children only need to be out of education for a short period of time before they start to suffer ill effects of that, not only in their educational attainment, but in their emotional health and well-being as well. And so when we're looking at advice around to parents, whether they're in a clinical risk group or whether their child is vulnerable, we take all of these issues into account when we're giving that advice, and we would never knowingly put any child or parent at risk of infection. What we do know is that not only does research show that the transmission of the virus is low, but we know that our schools have worked so hard to put in safeguards to ensure that they're safe places for children to be. And I'm sure Maxine will be able to say a little bit more about that. But I would say that if there is any parent who falls into that clinically extremely vulnerable group, or if you have a child that may fall into that group and you want specific advice about your own situation, please do contact the public health team, and we'll be able to give more tailored advice to your individual situation, which is what we can't do on a call like this. And again, our comms team can put that email address in, but it's quite simple. It's inquiries.publichealth@york.gov.uk. So I would encourage people to contact us if they have any specific issues that they want to talk through.
Thank you very much. Anything you'd like to add at this stage, Maxine?
Yeah, just to echo what Sharon's been saying, our school leaders have put an immense amount of time and effort into creating as COVID secure environments as they possibly can. They've been now working in this particular way really since March, because obviously they haven't ever closed their schools at any stage, even during the first national lockdown, and they've just got more skilled at working with the public health team, looking how to put the mitigations in place. They've revisited risk assessments constantly over the last months. And the other thing I would say for parents who are clinically extremely vulnerable, have a conversation with your school, make them aware of your circumstances. They will feed that into their individual risk assessments, and they will look at working with you on what's right for you and for your family. So it is important just to have that conversation with your school so that they're aware of what's concerning you. They can provide you with an external a virtual walkthrough of the arrangements that the school's got in place, but they will also as well consider what's right in terms of your circumstances, and sort of in certain circumstances they will work with you on making sure that they've put in the correct mitigations for you and your family.
Thank you very much for that. Don't know, Naomi or Kath, whether there's anything you'd like to add from a sort of perspective from a sort of whole family and get people going back to school?
Yeah, I can. Yeah, I mean, I would just echo everything, you know, that my other two colleagues have said. But what we do know is actually it's incredibly important for children and young people's emotional and mental health that they do continue to attend school, because children can very quickly fall behind on their emotional development as well as their academic. But I guess I'm more concerned around how children are managing emotionally, because if they're not managing emotionally, then they're not in the best place to learn. And again, any specific individual, I do understand that it's incredibly anxiety provoking and worrying, particularly for families where there is a member of the family that may have been in the shielding population before, or may be very vulnerable if they catch COVID. So again, speak to the school, speak to public health. There's also lots of information on our Recovery College website about talking to young people about this virus to try and minimise the impact that it might be having emotionally on them. So again, there's lots of information out there. There's also some really good national sites. So the Anna Freud Centre, Young Minds have got some really good information on there as well. But again, I say, as Maxine said, talk to the school if you're worried about your child in any way, about how they're feeling about attending school or how you're feeling about them attending school, then absolutely have a conversation with somebody that you feel happy talking to at school.
Thank you. Naomi.
Yeah, I just wanted to go back. I mean, I agree with everything that everybody has said so far about the need for young people and children to be at school and the risks of their isolation to their well-being. But I would also say, as a parent, you know, making decisions in this really unique and difficult time is you know, it's unprecedented. So to seek support for your own anxiety around COVID, you know, is totally normal in this time. And I would refer you back to the resources that we discussed at the beginning, that, you know, there are COVID related resources out there to help you as an individual and as a parent as well.
Thank you very much for that. Now, we had a number of particular questions in advance that relate to going back to school and education. And what I think I'll do is I'll ask all three as a block, and then I'll go around and different people can pick off the bits that they want to answer. So we've had a lot in what is City of York Council doing about free school meals. Obviously, that's been very topical in the news nationally and locally, and still is. Are City of York Council encouraging face masks in schools? And are the council going to fine parents who decide not to send their child to school? So if I go to Maxine first, it's entirely up to you whether you want to pick all three or do some for now.
Thank you, Keith. I'll try and answer all three, but I'll bring Sharon in as well on the face coverings question. In terms of free school meals, City of York Council was one of the first councils to actually declare that they would support children in the recent October half term when the government weren't extending the voucher scheme at that time. So the decision was taken by elected members to actually fund schools to provide those vouchers over the October half-term holiday. And the full council met very recently before the government announcement to say that they would also extend that funding to the Christmas holiday period as well. So I think the council's taken a very proactive stance around supporting children on free school meals. It's been very much welcomed by our school leaders, who felt that it was a really important thing that the council was doing, showing leadership in taking that stance. And regardless, as I say, of recent government announcements, the council's position was that it was going to continue to provide that support for children in the city. So in answer to that question, it was a proactive piece of work by City of York Council in taking that stance. In terms of face coverings in schools, we were also very proactive in before the government's guidance came out reinforcing the importance of face coverings in schools, our Director of Public Health, Sharon Stoltz, actually took the decision that she would recommend that they were used in all our secondary schools. And that was in advance of the DfE supporting that. So again, it was seen as an important protective measure in addition to all the other protective measures that our schools were taking, and our head teachers fully supported that stance. We also extended that to face coverings being worn by adults in our primary schools, again in advance of national guidance coming out around that. We felt that was again a really important preventative measure, which would make schools feel even more secure in their preventative measures. As Sharon said, there was some evidence that was going to be really important for those older age groups in schools, and I think it has really helped to keep schools open over the last half term. We haven't seen a level of school closures that has happened in some other areas of the country, and I'm fairly sure the preventative measures that were put in place actually really helped to do that. Don't know whether you want to add to that, Sharon.
Yes, I suppose I would add that I know those measures around face coverings haven't been universally welcomed by everyone in the city. And Maxine and I have both had contact with a number of individuals who challenged that decision at the time it was made, and challenged us as to why we were going further than government guidance at that time, and raised questions around our decision-making process around that. However, the majority of parents have supported this measure. And I think, as Maxine has said, you know, often the proof of the pudding is in the eating, isn't it? And in this case, we made the decision to introduce face coverings in the way that Maxine's described, based on international evidence and evidence from other countries and from the World Health Organization. And we did make those decisions ahead of our own government. But as Maxine has said, since then, the government guidance has changed and has caught up with the advice that we were already giving in York, which justifies the position that we took. And I would agree with Maxine that we've done incredibly well as a city in keeping our schools open and keeping them safe places for staff to work in and for children to visit. Really is because of all of the work we've done in partnership with schools, with children's services, with public health, with parents and families, to introduce all of those prevention measures. And, you know, they have been successful, and we need to keep up those measures and not become too complacent that we're doing well. We need to keep up with those measures, but they are working, which is fabulous for us as a city.
And the final question, well, obviously relates to fining for non-attendance at school. It's always been the stance of City of York Council that fining for non-attendance is the very last resort, because what we expect is that schools will work with families to look at how they can put in interventions and support which help to promote good attendance in schools. What I would say is that it is very, very important that children attend school regularly, both in normal times as well as COVID, because you cannot really underestimate the damage that is done by missing time at school. I think we're having it shown very graphically through the report that Ofsted published yesterday. And in York, what we've always stressed is the importance of schools working with parents and their local communities to help to support good attendance, and that we would only support the fining of parents if it became clear that all of that work was not having any impacts. So we only work with schools on requests around fining if they can demonstrate that they've put in every possible support and intervention to try and get children back into school. And that will continue to be our stance. That we would want to see evidence that schools are working and putting in place as many supportive measures and as many ways of reaching out to families to encourage good attendance, working also with colleagues in social care if that's appropriate, and with our local area teams, and that it would always only be the last resort that we would go to a legal sanction.
Thank you very much for the different answers to those questions. And as mentioned earlier on the Facebook call, if anybody watching live or who watches this afterwards has any more questions, do comment, and our communications team will pick them up, whether that be about schools, education, wellbeing, or those public health updates that we've discussed. Another question that came in advance, which again has been a really topical question, both nationally and locally, was: is the council making any plans for when a vaccine is ready? So I'll ask Sharon that question. And I think what a lot of people are asking is to try and understand the sense of time scale. Mm-hmm. Just because it was on the news doesn't mean it's all going to be here next week.
No. So where we are with the vaccine is that there have been some very positive developments and news, which I'm sure we're all aware of, that's been reported, which is really positive news. But it takes a while once we know that a vaccine works, it takes a while to produce that vaccine in large enough quantities to make it available for everyone. And so it won't be available for the general population for some months yet. So the initial plans that we're putting in place, working very closely with our NHS partners, who will take taking the lead for this first phase of the vaccine to particular groups. So it'll be offered to people over 80, care home residents and staff working in care homes, and frontline health workers will be in that first cohort of people who will be vaccinated. And even though we're planning to be able to vaccinate those people before Christmas, if I were a betting woman, which I'm not, but if I was, I would bet that we won't have that vaccine till after Christmas, realistically, even though we're planning. Once the vaccine is then available in much larger quantities, the number of people that will be offered it will be expanded. And those plans we're also starting to put in place at the moment, because we'll be talking about large groups of residents that we'll want to quite rapidly offer the vaccine to as soon as it's available to us. So yeah, those plans are in place. I can reassure anybody watching that work is happening at the moment. And nearer the time, there will be further information out to people around when that vaccine's available, and the timescales when different groups in the community will be able to access it. So yes, watch this space. Lots of work happening.
Thank you very much. Carol.
Thank you, Keith. I just want to add a little bit about the flu vaccine. You can't have two vaccinations too close together. So I want to urge everybody that's watching that hasn't had the flu vaccine, please have it, because it's still available to us. We've still got stocks, and you need to get that out of the way before you go on to the forthcoming COVID vaccine. So there's been a tremendous take up in York. It's been really great. I had mine ages ago. I'd urge everybody that hasn't and is eligible to do so, get your flu vaccine soon.
Thank you very much for that. With an eye on time, I'm going to start drawing this evening's session to a close in a few seconds. But I just wanted to check whether any of the panellists had any closing comments or remarks or anything they haven't had an opportunity to say. If you do, now is the time to raise your virtual hand. If not, hopefully you've had a chance to answer all of the questions that you have wanted to. I would like to just say a big thank you to everybody who's watching live and watching afterwards, getting involved on Facebook, in particular though to those on the panel and also those that asked questions. It's really important for us to hear your views, and do keep an eye out for future Facebook Live Q&As over the coming weeks. For example, there is one on Friday in particular for businesses, where I'm sure they'll be talking more about those business grants and what support there is for both small and large business in the city. I'd finally like to thank our panellists once again for giving their time and insight. And just to flag, if you do have any views and comments on the issues that we've discussed this evening, the council's running a big consultation, which is also included in the Our City newsletter that every household gets and is online. Do get involved and feedback, as this helps us to develop the council's approach to many of the big challenges that we face in York at the moment. Equally, please do keep leaving comments and questions on Facebook. And as I said, our communications team will keep answering those questions and giving you the links to those telephone numbers and email addresses that you need. And I'll just go back over it again. If you or any neighbour needs help or support, do contact the council, and it's 01904 551 550. Or the email address covid19help@york.gov.uk. And it just remains to say, have a good evening, everybody. Thank you very much.
Okay.